Okay, hi everyone. My name is Dr. Jodhpal Singh, and I'm a researcher in Saskatchewan, Canada. And today I'm wanting to discuss very briefly this topic of smartwatches and their ability to measure or monitor heart function. And really, I keep getting asked so often about different smartwatches, their different aspects of what they can measure when it comes to heart function. And I figured it would be kind of fun to put this together and take a look at heart function with smartwatches and see what the research is currently showing. In the future, if there's interest, I might do another series on sleep and how they can measure sleep as well. But for today, what we'll do is go through heart function here. Okay, so first let's consider, what type of watches there are when it comes to smartwatches. And, when you walk into your local Best Buy, Walmart, or wherever you're going to look at these, right away you'll notice very common or popular ones tend to be the Apple Watch. And it makes sense with the Apple Watch. I mean, everyone's got this Apple ecosystem now where they have a MacBook, an iPhone, iPad, and other Apple products as well. So the smartwatch just fits in very easily or seamlessly with those. And they're probably the ones I see the most as well. Other watches include the Fitbit. The Fitbit's been around for a very, very long time. It's got its own different application. And the Fitbit is actually owned by Google now. So along with the Google phones, the Fitbit seems to work very well. And really it helps Google stay competitive in the smartwatch world as well by using the Fitbit. Garmin is another one that probably you have not heard of too much. From my experience, or from everybody I see, the only ones I discuss Garmin watches tend to be athletes, really just athletes who compete in triathlons, and who are just very interested about getting really, really accurate data with respect to their steps, their heart rate, their temperature, all those kinds of parameters when it comes to the Garmin watch. Samsung, of course, has its own Galaxy watch as well. And these are probably the most popular ones, but outside of these, there's a lot of other watches that provide similar measurements and recordings. And they all use this technology called photoplethysmography, or PPG. And if you take a look at your Fitbit, on the reverse side, you'll always see like a little light shooting through, and that light is able to pick up your pulse rate, and then from your pulse rate, it can measure all different types of things, right? It can measure, all these different vital signs as well from there. So from these different types of smartwatches, really the main outputs that you get are very similar. And accuracy between all the watches seem relatively similar as well. Maybe the Garmin, might be a bit better for people who move excessively, just because that's generally what it's tested on when it's initially created. And then if you look at other watches like Apple Watches, Fitbits, they seem to be more accurate when you're relatively stable. So for example, when you're asleep. And other watches, again, usually have a different combination of accuracy when it comes to their different outputs. Okay, so, all that relative assessment aside, what I really want to take a look today is about how these watches are able to measure your heart rhythm and different parameters associated with your heart function thereafter. If you think about generally when you're trying to measure your heart rhythm, and let's say you're at the hospital and the doctor is sticking all these little electrodes all over you, that's called an electrocardiogram or an ECG or sometimes an EKG. If you're doing a stress test where you're walking on the treadmill with the speed slowly increasing, your heart rhythm based on what the EKG is showing provides very useful information to the doctor about, adjusting certain medications, making sure your heart function is completely normal, making sure, it's squeezing properly, making sure that you don't get too tired when you're exercising too early. All these things become really important. And by putting 12 different electrodes on you, or a 12 lead ECG, it gives them information about the heart from different perspectives. When it comes to research, within some physiology labs, a lot of the equipment only offers a 3 or a 5 lead ECG. And the whole purpose with some of this equipment is it's multimodal, right? Like it can usually measure your blood pressure, heart rate, all that kind of stuff within one computer-sized machine. And because of that, there are some limitations quite often associated with these lab research-based ECG assessments. But when it comes to things like smartwatches, so if you consider an Apple Watch, for example, when you put the Apple Watch on, it has something called a single lead ECG. And what that means is on the reverse side of some of these watches, it almost acts like a single electrode that has a point of contact on your wrist. And then you usually take your finger, you put it on the watch, and that closes that loop or closes that circuit between your body and the watch. And by doing that, the electrical activity or the current can be picked up from this watch, and you can get a single lead ECG signal that kind of looks like this green waveform in the back here. The cool thing with that ECG waveform is that it can tell you a lot about basic heart function, and really you're able to take that rhythm strip and provide it to your doctor just for them to have some of that information as well. Okay, so now when we measure the ECG, or even just a beat-to-beat pulse that the watch can pick up, it can provide us with parameters such as heart rate, parameters where if the heart rate is too fast, which is called tachycardia, or if it's too slow, which would be bradycardia. And what's interesting about this is that we can actually get really good insight to overall heart function simply based on an individual's heart rate, assuming there's no other underlying conditions with that as well. Another really important clinical utility of the smartwatch would be its ability to pick up atrial fibrillation. Now your heart has 4 chambers. 2 of them are used to send blood to the lungs, and then 2 of them are used to send blood into the body. The upper chamber is called the atrium, and the atrium usually has to put blood into the ventricle, but a lot of individuals get this little flutter that starts to occur in the atrium, which makes it very difficult to get an appropriate amount of blood into the ventricle, and it can actually also backlog a lot of the blood and cause many, many problems from there. And from a single lead ECG, such as your smartwatch, for example, like the Apple Watch, almost 90 to 95% of the time in research, it seems like it's accurate for detecting atrial fibrillation. The ECG strip comes out all wonky, and from there, you can usually get a good interpretation of whether or not you have atrial fibrillation. And by using the Apple Watch to identify some of these things, it gets really, really important to act quickly and act preemptively. And you can show your physician or your doctor the strip that the Apple Watch or whichever smartwatch you're using provided you in order to detect something like atrial fibrillation as well. So really, it's not a gold standard. I mean, you would still have to get some kind of Holter monitor. So that's where, you stay at the hospital for a few days and they attach all these different electrodes to you for a couple of days. You'd still have to get one of those done in order to confirm whether or not you have atrial fibrillation. But even though the smartwatches might not be a gold standard, they are a really good screening assessment. And then from there, you and your doctor can both make a decision on how to proceed next based on what some of these smartwatches provide you, which is really cool. And it provides you the ability to take your health into your own hands and just gives it a very unique clinical angle outside of just your heart rate. Okay, so a big application that is being used for these watches now is monitoring something called heart rate variability. Heart rate variability refers to the amount of variation there is in every single beat produced by your heart. Meaning, let's say in a minute, if your watch is telling you you have a heart rate of 70, well, not every single beat is going to be at 70 within that minute. That's just the average. One beat could be at 90, another one could be at 50. Depending on how you're breathing, it can also influence your heart rate. So the variation within each heartbeat and the sum of that is known as your heart rate variability. Now, the HRV or heart rate variability is very important to get an understanding of how much stress an individual has, just in very general terms. Um, and we can get a preliminary idea of how much different sympathetic or parasympathetic drive your body has. And again, at a very, very basic level, this refers to how much stress you're under or how much rest and digest activity your body is under. Um, and from there, we can get an understanding of why these things might be occurring. So, if we consider something like sleep, if you haven't been sleeping properly or enough just lately or throughout the week, then it gives us an idea of what would happen to your HRV. So you would get depressed heart rate variability if you haven't been sleeping properly. For athletes, quite often we see athletes with depressed heart rate variability on their watches. And a lot of this is because they're overtraining. They're not resting enough, they're training too much, and their body feels all sluggish and it just doesn't feel normal. So they're under so much systemic and physiological stress, and that's causing depressed heart rate variability as picked up by the smartwatch as well. And things like overtraining can lead to excessive inflammation around the body as well. And this excess and inflammation, especially if it's chronic over time, meaning it's sustained over time, then that can also really mess around with your heart rate variability measurements as well. When it comes to occupational responses, if individuals are working overtime too often or working 2 or 3 jobs sometimes, and just getting a lot of mental health problems and burden from working excessively, that can also be shown throughout the heart rate variability responses. Whether you're getting depressed, anxious, too nervous, those kinds of situations can also cause depressions in an individual's heart rate variability. And we see all these within the watch. If you're at rest, if you're taking a recording every morning for roughly a minute, ideally 5 minutes, but I don't know how many individuals can just sit there and take that recording for 5 minutes. But by having this information every morning on a continual basis, what you could do is identify if there's any changes that are occurring over time. And if there are, you can revisit why some of these changes might be occurring, whether it's because of excess stress, not sleeping enough, too much inflammation, some mental health related problems, or things like overtraining, overworking, and so on as well. And again, with the Apple Watch, I know it gives you that standard deviation, which is really important. Other watches also give you different measurements of heart rate variability. And all of these can be compared over time to see how much stress your body is under. Okay, so where do we go from here? Well, now many watches are starting to claim that they're in a position where they're going to soon be able to provide you with your blood pressure. This would be absolutely incredible, as you can take it essentially every morning just from your watch in this case, and alongside some of your other measurements, all at the exact same time. Depending on the accuracy, it would be really neat to do this instead of doing it at the doctor's office. Again, assuming accuracy is good and you're doing it properly, of course, just because that way we can avoid things like white coat syndrome, where when a patient goes to a doctor's office for things like a blood pressure reading, they tend to get a little bit too nervous or anxious, and that could really increase the blood pressure quite a bit. Aside from blood pressure, another important variable, especially if you've had any kind of heart procedure before, is cardiac output. Now, this is how many liters of blood your heart is pumping every minute, and it can provide you with insights to, those who have been treated with heart failure, with a heart attack, and those kinds of conditions as well, like how they're progressing, how the medication's working, and so on. In combination with other hemodynamic variables as well, we can even potentially be in a position where we can measure the risk of somebody for developing heart failure or having a heart attack simply based on the variables that the watch is providing on a consistent basis. So for future directions, this is where research is now moving.